Good morning, students. Myself, Dr. C. Bharath, Assistant Professor, Department of Public Health Dentistry, Vinayak Mission Sankaracharya Dental College, will be presenting my topic titled Introduction to Fluorides. This is my lesson plan. So, in this, I will be talking about the learning objectives, the pre-assessment, topic content, and post-assessment. There are some Viva questions and MCQs to be answered. This is a topic learning outcome. So, at the end of this lecture, the student should be able to describe the different sources of and metabolism of fluorides and list out the various fluoride delivery methods. These are my contents: introduction, history of fluorides, sources of fluorides, metabolism of fluorides, mechanism of action, fluoride delivery methods, conclusion and references. Coming to introduction, fluorine is the 17th most abundant material on the earth's crust. So, fluorine is abundantly present throughout the world. So, it is a mineral that occurs naturally in all the water sources, mainly the oceans, rivers, all these have some amount of fluoride content in the water. So, fluoride is effective in preventing and reversing the early signs of dental caries. So, as you all know, fluoride is a caries active agent or caries protective agent. So, when this fluoride is taken, it has an ability to reverse the early caries, early caries lesions. It has the ability to reverse the early caries lesions. Coming to history of fluorides, the history of fluorides dates back to 1901, where Frederick Mackay discovered some permanent stains on the teeth, where he termed it as the Colorado stains. Later in 1916, Mackay and Black examined about 6,873 individuals, and he reported that an unknown causative factor was responsible for the mottling of enamel, which was mainly due to the amount of fluoride content that is present in the domestic water supply. Later in 1931, a shoe leather survey was carried out by Trendley H. Dane. This was the main milestone study which put forward that the most important aspect of this fluoride and what are the main causative factors and how a fluoride helps in prevention of dental caries. So, in this study, Trendley H. Dane was assigned with the job to continue with the Mackay's work and to find out the extent of the geographical distribution of the mottled enamel by a US Public Health Service. Later in 1942, Dean discovered that 1 ppm of fluoride was the ideal requirement of amount of fluoride that is required for the prevention of dental caries. In 1945, world's first artificial fluoridation plant was started by Grand Rapids in USA. So, in 1931, the milestone study was conducted by Trendley H. Dane, that is known as a shoe leather survey. So, in this shoe leather survey, the Trendley H. Dane was given the task mainly to find out the extent of this mottling of enamel or enamel fluorosis that is present in a geographical area, and then what are the main causative factors for the occurrence of this mottling of enamel. Later, Dean confirmed this existence of fluoride in the water supply, that was the main causative factor for the occurrence of this discolorations or mottling of enamel that is present in the teeth. So, coming to the sources of fluoride, the principal sources of fluoride that is ingested by humans is water. So, even certain plants and animals, marine animals also have some amount of fluoride content in it. So, the earth's crust contains about 880 ppm of fluoride, whereas the rocks contain about 300 to 700 ppm, and seawater contains about 0.8 to 1.4 ppm of fluoride. Whereas in the atmosphere, it is widely distributed even from gaseous forms from various coal burnings. So, the abundant amount of fluoride is present in the fish. So, any marine animal usually have some adequate amount of fluoride in it. So, fish contains about 19 ppm and seafoods contain about 84.5 ppm. Tea leaves contain about 97 ppm of fluoride, potatoes contain about 6.5 ppm, vegetables, cereals and fruits contain about 0.2 to 0.3 ppm. Fluoride in beverages is about 0.05 to 1.05 ppm. So, next we will see the metabolism of fluoride. Till now we saw about what are the different studies that were conducted, that is a history of fluorides, then we saw about the sources of fluorides. Now, we will see the metabolism of fluorides, how a fluoride is absorbed and how it is distributed in the body. So, fluoride homeostasis depends upon the dynamic equilibrium between the fluoride that is intake, that is the uptake of the fluoride in the body, and how a fluoride is excreted from the body. So, it depends upon a dynamic equilibrium between the absorption, deposition in the different structures of the body and organs of the body, and also the excretion of fluoride. So, how a fluoride is excreted from the body. The metabolism of fluoride is mainly the amount of fluoride that is ingested by the person. So, it depends upon the topical and the systemic fluoride that is taken by the person. So, it can be a topical or a systemic fluoride that is ingested by the patient. So, when a patient ingests this particular fluoride from different sources, it gets absorbed by the oral fluids. So, plasma is mainly considered to be the part where maximum amount of fluoride is absorbed, and from the plasma it is again distributed to different parts of the body. Fluoride gets in contact with the oral fluids. So, from the oral fluids the fluoride gets deposited on the tooth surface and also the plaque that is present on the tooth. So, from this plaque the fluoride has an antibacterial and anti-plaque action. So, it helps in prevention of dental caries, and from the plasma or from the oral fluids it gets absorbed by the plasma. So, plasma is generally considered to be the central compartment from where it is distributed to different parts of the body. Most of the absorption is from the gastrointestinal tract. So, this GIT is the most important aspect of this absorption. So, most of the fluoride that is absorbed from the body gets absorbed mainly from the gastrointestinal tract. From the gastrointestinal tract it gets deposited in the plasma. So, from the plasma it gets deposited to different parts of the body and also it is excreted. So, from the plasma it gets excreted through the sweat and also the milk, and then from the plasma it gets deposited in the skeletal muscles. So, skeletal muscles are mainly plays a role in the deposition of fluoride, that is maximum amount of fluoride is always deposited in the hard tissues of the body, that is your skeleton and the tooth surfaces. That is why you see more amount of many patients suffering from dental fluorosis and skeletal fluorosis. From the plasma again it is excreted through the urine. So, this is the overall metabolism of fluoride. So, from the just any amount of fluoride that is ingested gets in contact with the oral fluids. So, in the oral fluids it has a topical action. So, it gets in contact with the tooth surface and helps in remineralization of the particular tooth surface. From the oral fluids gets absorbed in the gastrointestinal tract. From the gastrointestinal tract it gets deposited in the plasma, where it is known as a central compartment from where it is distributed and also it is excreted from the body. Coming to metabolism of fluoride, the fluoride absorption mostly occurs from the gastrointestinal tract. So, absorption of this fluoride is rapid as plasma fluoride reaches a peak in about 1 hour. So, maximum amount of fluoride is reached in about 1 hour, and then there is a slow and gradual decline in the absorption of fluoride. And in any amount of calcium that is present during this absorption, it has a reduced effect in the main absorption process. Fluoride in the blood plasma, it occurs at two forms, that is your ionic and non-ionic forms. In the ionic form it is absorbed and distributed in the body. The normal level ranges from about 0.7 to 2.4 micrograms, and fluoride in saliva occurs in two forms, that is your unstimulated saliva and your stimulated saliva. Unstimulated saliva contains about 0.018 ppm, whereas your stimulated saliva contains about 0.013 ppm. So, till now we saw about how a fluoride is metabolized, how it is absorbed. Now, we will see the distribution of fluoride, how a fluoride is distributed to various parts of the body, and also how it is distributed to different parts of the different organs that is there in the body. So, this fluoride reaches faster in the well perfused tissues, that is your heart, lungs and liver, whereas it is less perfused in the skeletal muscle, skin and the adipose tissue. Blood-brain barrier is effective in restricting the passage of this fluorides, and approximately 99% of fluoride in the human body is found mainly in the mineralized tissues. That is why this fluoride is a mineralized bone seeker, that is mostly it gets deposited in the hard tissues of the body, that is your skeletal muscles. Coming to intake of this fluoride, the most concentration is from the meat, fish and the poultry products. Fluoride in dentifrices contain about 1000 to 1500 ppm. Children aged about 0 to 6 years, there is a 44% of paste is usually swallowed and completely absorbed. So, mostly it is stored in the hard tissues of the body, that is your bone, enamel and dentin, blood, placenta and fetus and saliva. So, how until now we saw about how fluoride is stored, how it is distributed to various parts of the body. Now, we will see how a fluoride is excreted out of the body. So, the excretion of this fluoride is through the kidneys. So, major route of excretion is through the kidneys. So, there is very much amount of fluoride that is absorbed, that is reabsorbed and then enter into the systemic circulation, whereas the remainder will get excreted in the urine. So, percentage of filtered fluoride, it is reabsorbed from the renal tubules can ranges from about 10 to 90%, and the degree of reabsorption depends largely on the pH of the tubular fluid and the urinary flow. So, excretion via sweat is about 1/10 of a milligram of fluoride. Now, we will see about what is a shoe leather survey. This survey was conducted in the year 1931 by Trendley H. Dean to find out the relationship between the fluoride concentration in the drinking water, mottled enamel and dental caries. So, there was a questionnaire survey that was conducted mainly to see the extent of the fluoride distribution in a particular geographical area, a number of people that are affected by this mottling of enamel. So, it was conducted among 97 localities, mainly Cortland, Virginia and North Carolina, Tennessee and Illinois. The main objective of this study is to find out the geographical distribution and number of patients that are affected. So, from this survey it was found out that patients are mostly suffering from this fluorosis. They were located in a particular geographical area. So, because of the high amount of fluoride that is there in the domestic water supply. So, when they change the domestic water supply to a different source, there is a gradual decline in the amount of fluorosis that are present in the particular area. So, from this survey they found out that the fluoride exposure is mainly dependent on the amount of fluoride that is present in the particular area. Coming to the mechanism of action of fluorides, mechanism of action of fluorides is mainly by increased enamel resistance or reduction in the enamel solubility, increased rate of post-eruptive maturation, remineralization of incipient caries lesions, interference with plaque microorganisms, modification in the tooth morphology. So, we will see one by one in each one how fluoride helps in increasing the caries resistance, how it prevents dental caries from occurring. So, first we will see about increased enamel resistance. What is increased enamel resistance? Increased enamel resistance is nothing but it increases the resistance of a tooth to dental caries. That is, the action of fluoride is due to the apoptite lattice, that is there will be voids that are present in the tooth surface, that is your hydroxyl ions. So, a tooth consists of hydroxyapatite crystals. So, when this fluoride is present at the time of tooth eruption or during the course of tooth eruption, what happens is the hydroxyapatite crystals are converted into fluoroapatite crystals. So, these fluoroapatite crystals are more caries resistant when compared to a hydroxyapatite tooth. So, the fluoride ions fill the voids that are present in the hydroxyapatite crystals. So, how they fill? It is mainly due to the voids that are present in the hydroxyapatite crystals. So, due to the hydrogen bonding tendency, their forces act on this and then they fill the voids mainly by the fluoroapatite crystals. Okay. Till now we saw about what is increased enamel resistance, that is a tooth is there, a hydroxyapatite tooth is there. So, when fluoride is present in the oral cavity at the time of tooth eruption or immediately after a tooth is erupted in the oral cavity, there is a replacement of the hydroxyl ions in the tooth. So, by the fluorapatite crystals. So, the fluorapatite crystals gets in contact with the hydroxyapatite crystals and gets converted into fluorapatite crystals. So, these fluorapatite crystals are generally more caries resistant when compared to a hydroxy ion groups. Next is increased rate of post-eruptive maturation. So, after a tooth is erupted into the oral cavity, there is increased rate of post-eruptive maturation, that is, at recently erupted tooth usually have hypomineralized areas. So, these hypomineralized areas that are more prone to dental caries. So, the fluoride acts on this hypomineralized areas and there is a increase in the enamel resistance of a tooth. So, these hypomineralized areas or enamel opacities that are present in the oral cavity. So, the fluoride acts on this hypomineralized areas or enamel opacities and makes it more caries resistant. These hypomineralized areas are more susceptible to dental caries. So, the fluoride acts on this hypomineralized areas and makes it more caries resistant. So, as soon as a tooth is appeared in the oral cavity, the fluoride acts on this and increases the rate of mineralization and post-eruptive maturation of these areas. Next is remineralization of incipient caries lesions. So, what is this remineralization of incipient caries lesions? So, any incipient caries lesions like any pit and fissures that are there, any small pits, any voids or any hypomineralized areas, their fluoride acts on these areas and they help in remineralization of the incipient caries lesions. So, how it acts? It is mainly that it is due to the deposition of minerals into the previously damaged areas of a tooth. So, any previously damaged area of a tooth like any opacities or any incipient lesions, caries lesions are there, any pits are there, it results in reduced enamel solubility due to the growth of crystals that are larger than those in the either a demineralized or a sound enamel. So, fluoride enhances the rate of remineralization from the calcium phosphate solutions which in mouth come from the saliva and the tooth mineral gets dissolved during a demineralization process. So, whenever an incipient caries lesion is there, it is more susceptible to dental caries. That is, if the patient does not maintain the oral cavity properly, does not maintain the oral hygiene practices properly, then this areas are more susceptible to dental caries, that is, they are demineralized areas. Fluoride acts on this demineralized areas and helps in remineralization of this incipient caries lesions. Next is interference with microorganisms. Interference with microorganism is nothing but the microorganisms usually are more prone to dental caries. That is, the microorganism, the most important is your Streptococcus mutans. So, Streptococcus mutans is the primary organism that are responsible for the occurrence of dental caries. Other than this, there are other organisms which helps in increasing the demineralization of a tooth surface. So, the interference with microorganisms is nothing but at high concentrations fluoride is bactericidal and at low concentrations it is bacteriostatic. That is, at high concentrations it is bactericidal, that is, it helps in destroying the amount of bacteria that is present in the oral cavity. So, the fluoride acts on this microorganisms and helps in destroying the microorganisms. So, whenever a patient drinks any sucrose content or any food that is rich in sucrose, they produce acids in the oral cavity. So, these acids that are produced in the oral cavity helps in demineralization of the lesions. So, it develops into a plaque, a biofilm is formed and then a plaque is formed. Later the microorganisms gets invaded in the plaque, that is the Streptococcus mutans is the first organism that gets invaded. Later, if the patient is not following the oral hygiene practices, then there is a plaque maturation and there is secondary colonization that is occurring due to the presence of other organisms like your Streptococcus acidophilus. So, in this way the demineralization is occurring due to the acids that are produced in the oral cavity. In the presence of the fluorides, what happens is the fluoride acts on this microorganisms and it kills the bacteria. In this way it helps in prevention of dental caries. And in low concentration the fluoride is bacteriostatic, that is, it helps in destroying the organism, that is a bactericidal action, whereas in lower concentration it is bacteriostatic, that is it helps in reduction of the microbial load. In this way it helps in controlling the growth of bacteria without destroying them. So, it helps in reduction of the bacterial count in the oral cavity. In this way it helps in prevention of dental caries. And also fluoride lodges in the plaque and inhibits the bacterial enzymes that are responsible for acid formation. Last one is modification in the tooth morphology. As you all know, the tooth usually have deep pitten fissures which is more susceptible to dental caries. So, these pitten fissures are the most commonly involved tooth surface that is more prone to dental caries, followed by your proximal areas. So, these deep pitten fissures are responsible for the occurrence of dental caries. So, the modification of tooth morphology is at the time of tooth eruption or immediately after a tooth is erupted into the oral cavity, there is a modification of the tooth morphology, that is the deep pitten fissures are converted into a shallow pitten fissures or self cleansing areas. So, these self cleansing areas are the most important aspect in the prevention of dental caries, that is the deep pitten fissures are converted into shallow pitten fissures where it helps in prevention of dental caries, that is the plaque and the debris will not get deposited in the deep pitten fissures. So, in this way it is a self cleansing areas, they are more, these self cleansing areas are less susceptible to dental caries when compared to your deep pitten fissures. So, if a fluoride is ingested during tooth development, there is some evidence to suggest that the formation of more caries resistant tooth, that is slightly smaller with shallow pitten fissures. So, any diameter and cusp depths are smaller if the fluoride is present during the tooth development. So, when a fluoride is present during at the time of tooth development, it helps in conversion of this deep pitten fissures into a shallow or a self cleansing areas. So, change in the morphology of a tooth would tend to decrease the caries susceptibility of a tooth to make it more self cleansing areas. So, these self cleansing areas are helps in prevention of dental caries, that is prevention of plaque formation, in turn it helps in the prevention of dental caries. So, fluoride action of the teeth is mainly due to the hydroxyapatite crystals that are present in the oral cavity. So, the subsurface and surface lesions usually of enamel absorbs and holds the amount of fluoride in it. So, when you see this, the outer enamel surface usually have high amount of fluoride when compared to a inner enamel surface. This facilitates the growth of crystals in areas that are demineralized, which is called as a remineralization. So, when this demineralization is occurring, fluoride acts on these demineralized areas and helps in conversion of this demineralized areas into a remineralized areas. So, fluoride incorporation chemically forms new crystals that are larger and more acid resistant and contain higher concentration of this fluoride in it. So, when you see the enamel, outer enamel usually have a high amount of fluoride when compared to inner enamel. Similarly, a dentin has a lesser amount of fluoride when compared to your enamel. Okay. The last part is your fluoride delivery methods. I will just explain you what are the different fluoride delivery methods that are available. The fluorides are mainly classified into a topical and a systemic fluorides. So, under systemic fluorides you have community water fluoridation, school water fluoridation, dietary supplements, salts fluoridation, milk fluoridation and fluoride drops. So, what is the difference between a topical and a systemic fluorides? Topical fluorides are usually ingested by the person topically. So, how a topical it acts? Mainly the action of this topical fluorides is based on the contact with the tooth surface. So, the fluoride that is ingested either in as a stannous fluoride, sodium fluoride or acetylate phosphate fluoride or any fluoride varnish which gets present in the which gets absorbed by the tooth surfaces. So, it has a topical effect. So, how it has a topical effect? It is mainly due to the absorption of the fluoride in the oral cavity. From the oral cavity, the fluoride gets absorbed through the saliva. So, it is present in the saliva. From the saliva, it gets deposited in the oral cavity, that is your tooth surface absorb this fluoride, mainly the hydroxyapatite crystals take up this fluoride and converts into a fluoroptide crystals. In this way, it has a topical effect. Systemic effect, usually it has a systemic effect, that is mainly through the absorption of this fluoride and distribution of fluoride into the various organs of the body. That is a systemic fluoride. So, under systemic fluoride, there are different methods of systemic fluoridation that are usually followed. Under this, the most important is your school water fluoridation and your community water fluoridation. You have other fluoride delivery methods, that is in other countries like New Zealand, they are following salt fluoridation and milk fluoridation also. Then you have fluoride drops, which has a systemic effect. So, we will discuss this in the next class. Like I said, the topical fluorides are usually of a professional and self-applied fluorides. Professional applied fluorides are usually of a sodium fluoride, stannous fluoride and acylated phosphate fluoride. Sodium fluoride concentration is 2%, stannous fluoride is 8% and acylated phosphate fluoride is about 1.23%. Fluoride varnishes are Durafed from fluor protector, whereas self-applied fluorides, that is it is given to the patient to use it daily. That is your fluoride dentrifiers, that is your toothpaste, the fluoride mouth rinses and your fluoride gels. To conclude, the primary caries preventive effect of this fluoride results from its topical contact with the enamel and through its antibacterial actions. So, fluoride continues to be the cornerstone of dental caries prevention throughout the world, and there are a variety of sources of fluoride that may contribute to the dietary intake of the fluoride. These are my references. Thank you for watching my class.